Here we have a 30-year-old female patient posted for lap cholecystectomy. Post-intubation, we plan on giving a transverse abdominis plane block or the TAP block. The landmarks for the TAP block are: first palpate for the costal margin, and then next we palpate the iliac crest. At the mid-axillary line, at the midpoint between these two landmarks, at the level of umbilicus, is the point where we insert the needle for the TAP block. Before inserting the needle, we have to make the needle a little blunt. And once you insert the needle, we find two pop-ups, first at the level of external oblique muscle and second at the level of the internal oblique muscle. And then we enter into the plane between the transverse abdominis muscle and the internal oblique muscle where the drug is given. Things required for TAP block: we need a 10 cc syringe, an aspiration needle and a 22 gauge block needle. In case the patient is obese, we use a 23 gauge spinal needle or a 20 gauge IV cannula. Coming to the drugs, the drug that we have taken for this patient is 10 cc of bupivacaine 0.5%, 10 cc of lignocaine 2%. We dilute it up to 30 with 10 ml NS and 4 mg of dexamethasone as additive. The patient has now been intubated, and under all aseptic precautions we have painted and draped the patient with betadine and spirit, and the landmarks have been marked. As patient is obese, for this patient we will be using a 20 gauge gelco. We remove the stillet and we use the stillet as the block needle. Before giving the block, we are going to blunt the tip of the needle. Now we are starting with the block. We have given the skin, injected the needle at the skin,
going inside. This is the first pop-up. Oblique.
First pop-up with the level of external oblique.
Going inside.
As we go inside, we get another pop at the level of internal
pop-up.
oblique. Now we are in the plane between internal oblique and the transverse abdominis. First we aspirate to confirm that no blood is there. We're giving 2 cc of drug. We can see that there's a backflow of the drug. This indicates that we are in the right plane.
Backflow is there. It indicates we are
In the right plane. Oblique and the transverse abdominis muscle.